Okay, thank you, Tristan. Dr. Wu, thank you so much for having me and for inviting me to present. I'm very excited to present to your UNT campus. I'm going to speak about COVID-19 marginalized populations and technology. And I'm going to give you a little bit of an overview in the beginning on how this came to be. The presentation will also be a hodgepodge of kind of everything that I've been doing since March of last year, because I had a lot of different projects that are all touching on marginalized populations and technology as it relates to the pandemic. The other thing that happened is two things happened to me. I got married, so now I've changed my name to Bennett Gayle. And I also am newly a mother. And so I was telling Tristan that, this time period right now, I'm actually on maternity leave. And so it's been a little bit chaotic. So there's just a lot that's been happening. And I've actually been able to touch on the whole marginalized population a little bit more personally. So COVID-19 pandemic, I'm not going to go through, how the pandemic is, but because we're all living it, so we know that. But I am going to touch on how it's affected us in employment, education, healthcare, and daily living. So for example, in employment, as we're doing now, I'm not on your campus. We're all on screen using Zoom or WebEx or some other kind of conferencing software to kind of do our work. Other people who have different types of jobs are figuring out how to adapt that at home. If those of you who don't are unable to stay at home, you may be an essential worker. And so then we have people that are actually working during the pandemic and being at their jobs, but their jobs have also changed a little bit. And sometimes they've inserted some sort of technology with that. On top of that, there have been a number of people who have been unemployed, furloughed, or, basically let off or let go for a time period during this pandemic. So employment has been impacted at the individual level. For education, for those of you who have children or are in school, you know that you've been doing things remotely as much as possible. And either you've been trying to homeschool your children individually with separate computers, if you have more than one child. And if you are on campus here and working and going to school, you know that you're doing a lot of this stuff online as much as possible. A lot of campuses have started to come back, but they have these optional remote opportunities, especially for those who end up testing positive for COVID. Healthcare, we've started to embrace telehealth in a new way. And that has been, phenomenal for some populations. And for others, it has been a little stressful. We've also started tracking people with COVID-19, trying to make sure that we do contact tracing, and we've used a lot of different technologies for that. And then with daily living, believe it or not, just things outside of employment, education, and healthcare, every part of our life has been touched. And it's sort of just brought on, or the catalyst has been the pandemic. I, for one, have been buying groceries online, and that way I don't have to go through the store to get them, but that has been challenging. Just the other day, I purchased grapes, and I wanted a bag of grapes, and somehow I got 10 grapes. Somebody picked off 10 grapes to give to me, and that just sounded really ridiculous, but we're still learning out how to use some of these things and make it easy and simplified for people. Other things that we've done is do things like get married online. That's a whole new industry that has basically started up due to COVID-19. And it's, legal. The first place to legalize it was here in New York. But our court systems, a lot of different things have been touched by COVID-19. So for me, I look at COVID-19 as a disaster. I'm a disaster scholar. I look at, emergencies and disasters in a certain way. And so even though a lot of people have been looking at it solely as a public health emergency and from a public health lens, I've been looking at it through the lens of being a disaster. And I use a specific definition that's loosely based on Fritz, 1961, and I've kind of truncated it here, where disasters are social events which cause social disruption, where the needs exceed the capability of the area. There has been some international discussion about the needs exceeding the capability of the area, especially since we're talking about a pandemic where, the needs have been exceeding a lot of people's capabilities in every area. But using this definition, I'm able to look at COVID-19 as an event. And I specifically have been putting this definition in a lot of my presentations and also in my um, journal articles, specifically because I haven't been publishing recently in a lot of disaster related journals. And so I've been getting a lot of questions, especially during review, about how is COVID-19 a disaster? And so a lot of individuals outside of our field tend to think of disasters as acute onset type events that have a specific start and end period. And that more and more, actually, I'm noticing this more and more, is that the disasters also in their mind typically induced by natural hazards, as opposed to it being anything human induced or anything like a infectious disease outbreak. So with this definition, it kind of leads into this idea that disasters are not necessarily natural. Hazards are natural, can be natural, but disasters can be caused by natural hazards or caused by human-induced accidents or human-induced like terrorism type events, and that disasters are not all rapid onset events having a specific time frame. I put that in there because for the life of the time that I've been looking at disasters, I've always included pandemics and also things like, drought. And so because of this, you have to think about it a little bit more broadly. But there are certain things that we've always known from disasters. And with marginalized populations, we've noticed historically there's been populations that have been disproportionately impacted before, during, and following a disaster, and that these populations tend to be marginalized within a society prior to the disaster event. And this is true regardless of the society or the nation that we're talking about, or the region of the world. And so we can kind of pinpoint this. I like to take this testimony from Curtis Brown, who is the state coordinator or the emergency manager for Virginia Department of Emergency Management. He's also the co-founder of the Institute for Diversity and Inclusion of Emergency Management, or IDEM. And one of his testimonies on the Hill for Congress was about vulnerable populations and disasters, and how COVID-19 is a disaster and has led to different disproportionate impacts. And so his quote is that the ongoing impact of COVID-19 disaster, as he puts it, has demonstrated once again that disasters disproportionately impact Black, Indigenous, people of color, low income, and people with disabilities. Both primary impacts, such as the fatalities and COVID-19 cases, and the numerous secondary negative economic, such as unemployment and health impacts, have ravaged marginalized individuals and communities. And sadly, this disproportionate impact of disasters on vulnerable populations is no surprise. In fact, I did a presentation in March where I started to talk about vulnerability during disasters for COVID-19 and said specifically that there are certain populations that are at risk. And so we have been talking about, at the time, physical vulnerable populations, and that's kind of how I termed it, because we kept saying, well, it's these older adults, people with pre-existing conditions, and first responders who we need to talk about, or the first, frontline workers is what we're calling them. Cashiers, medical staffing, cleaning staff. And I said, but there are always going to be other populations that are at risk, because that's what our research has been telling us. The historical precedence has also told us that there are socially vulnerable populations. And so while we had this physical vulnerability to COVID-19, there were socially vulnerable populations that were going to come up. Initially, I listed this as older adults, children, people with disabilities, those with pre-existing health conditions, pregnant women, racial and ethnic minorities, low-income populations, individuals without access to transportation, and gendered minorities was kind of the start that I gave, which was interesting because one of the things is that at the time I was pregnant and was really thinking, oh my goodness, this is, it's really hitting home. But there's also a lot of things that we hadn't actually seen come to light then. So one of the things, one of the theories that I started looking at was, let's see if I can go back here. Oops. And hold on one second. This is not allowing me to go back for some reason. How do I do this? Yeah, one of the theories or one of the perspectives I started looking at was the lens of vulnerability from Peacock in 2014. One of the things that they'd used this for was housing, and was looking at the pre-existing inequalities prior to acute onset disasters. In terms of housing or access to housing, and then how those led to exacerbated inequalities during recovery. But I looked at this in terms of access, right? Access to whatever was needed at the time. And so it could be access to communications, it could be access to employment, it could be access to education. And so I start looking at this in terms of access to technology, because one of the things that happened is that, especially in the United States, we started to implement social distancing, is what we were calling it, where we wanted people to stay far away from each other. Here in New York, we shut down a lot of different things, like I know all of the non-essential businesses shut down, and individuals were asked to stay at home and figure out how to work from home. And to do that, we started relying heavily on technology. And then once you start doing that, you have to realize that it wasn't equally for everyone. So those with pre-existing inequalities in terms of technology started seeing a larger impact or a larger vulnerability with trying to keep up with society. And that in terms of education, healthcare, employment, and daily living, because everything was connected, right? So it's not just the fact that, you know, it's not, we're talking beyond the digital divide here. So it's not just, oh, I didn't have access to it, because maybe now you're getting access to broadband wireless in some way, but maybe you don't have the technical ability to download the specific app you need for education, or you need specific access to different technologies in order to really fully engage in the class. And so that would put you now more vulnerable to like falling behind your peers. And so we still see exacerbated inequalities when it comes to just the access of technology, because the entire society, for the most part, started to rely on technology in a way that some technophobes were not actually doing. So now they had a larger burden to bear, right? And so, to be honest, that still follows these populations at risk that I was talking about before. With technology, I am specifically talking about technology that requires broadband wireless. I tend to look at mobile devices for the most part, but I kind of expanded it in looking at technology in terms of how we communicate and how we communicate big data and use it for getting situational awareness. So that includes video conferencing software, mobile wireless applications, whether you're putting them on your phone or on your tablet. I have noticed I've been looking more and more at unmanned aerial vehicles, or UAVs, and robots, and how those have been used. And I've started to see an increase in the uptick in artificial intelligence. So let me kind of go through what I saw early on. Technology during COVID-19 response. And so I'm calling this the response phase. This is early March and April, when I kind of just started pulling out what was going on in our society. And this is specifically for US. I started looking at what was going on in terms of communications. We started seeing online learning and video conferencing. We started seeing ed tech vendors confront stunning opportunity and risk of the online learning and video conferencing. And specifically, this was for higher education. What was interesting is that, I don't know if you remember, initially you started moving to Zoom, and then there was this thing called Zoom bombing in classes, right? And so the fact that we moved so quickly to using this technology in a different way and massively, we started to increase our risk for privacy and security concerns. Then we already started to see things like different universities, and you know, again, this is March, right? So Columbia, Harvard, NYU, other major US colleges and universities started to switch to remote classes and telling students to move out of dorms. And so that puts another spin on it, right? So you have this connection where we're moving online, and that is also affecting people's housing and sheltering for a lot of the students. Colleges and universities across the US are canceling in-person classes due to coronavirus. And you can see this through different places, right? And so this was happening at higher ed. The same thing was similarly happening from, you know, P through or K through 12. Communications, we also saw things happening with social media and mobile devices. We started seeing things like club quarantine, right? Online concerts. We're drawing famous viewers and people starting to enjoy themselves differently. List of virtual concerts to watch during the coronavirus shutdown. The Baltimore Symphony Orchestra starts online concert series. So there was a whole new genre in terms of daily living and kind of play, right? So if you think of the first part about education, we started doing different things in terms of how we engaged ourselves for play or downtime activities. We started seeing differences in terms of services as well. So there was this idea early on that because of the coronavirus, we were going to see an uptick in autonomous vehicles and delivery robots. That's what we thought in March. We started realizing that AI was starting to become a big factor. The White House started to use AI for certain things, as well as hospitals and using it to manage the coronavirus outbreak, using it to figure out what was going on with individuals, and to figure out how to figure out the data science technology and the research that was ongoing in these areas to fight the pandemic. And with healthcare, we started to see a lot happening there, right? So there's telehealth that started happening, and telemedicine. So what we realized is that all of a sudden, in terms of healthcare, it was like, oh, wow, now we can do telehealth. Now we can do telemedicine. Things that we were asking for before, or a lot of people were asking for before, became possible. This is one of the areas in which it was very beneficial for a lot of marginalized populations to be able to use telehealth and telemedicine, but only if they were able to use the tele part of that, right? If they had the technology to be able to get online, if they had the access to whatever device they needed to be able to do this. And then this started emerging as a healthcare option during COVID-19. And I know that a lot of insurance companies started to waive fees for telehealth and telemedicine during this time as well. So initially, one of the things that we did was kind of did a scan of what was going on. So we did a kind of a literature review, a systematic literature review, if you will, on what we have happening in terms of these areas with regard to COVID-19, specific marginalized populations. And for me, it was people with disabilities and older adults, and due to COVID-19. With employment, we started realizing there were some concerns about access to the office from home, that there needed to be new pathways for individual employment opportunities. As we moved online, we started to leave behind people who needed accessible technologies. We assumed that everyone could just do it with their computers and their internet, but not thinking about any accessibility options that they may need. And as you've been using Zoom, hopefully you started realizing they have increased their accessibility features, little things, right, over time. And that's due to people starting to say, hey, I'm unable to see, well, I can use Zoom, for example, but I need an ASL interpreter. And then once you do that, you could, at one point, this was probably about 2 months ago, you could pin a person, right, and see that person on the screen. But it would be the person who's talking. ASL interpreters don't talk, so they're not pinned. So now you're looking through however many people are on the screen to find the ASL interpreter so you can actually see them. Recently, Zoom has allowed you to pin more than one person, and that actually helps out with trying to see an ASL interpreter, as well as, say, my screen and me sharing my screen, if that were an option. The other problem with access to the office from home is the need to expand digital literacy and increase broadband access. There are places that still have very, very poor broadband access. And a lot of this is rural communities, but it's also low income communities, people where they can't afford it. And what I've noticed recently is that as I have actually up my bandwidth here, I think everybody in my neighborhood has. And so it's actually causing problems on a larger scale for our provider. The need to expand digital literacy is extremely important as well. It's not something that everyone has been talking about in terms of the fact that, you know, you have to think about what people can do. So let me explain. And this is not necessarily related to employment, but you'll start to see the trend. Here in New York and, well, in Florida, for example, my grandmother wanted to get the coronavirus vaccination. And she could get the vaccination because she's over 90 something years old, right? But she had to sign in online in order to get a appointment to be able to do that. And that was an impossibility for her. That was a big hurdle for her, right? How do you get online? Where do you go? How do you get to get your appointment? And is this not just her digital literacy, but also did they make it where it was user friendly so that other people would be able to do it pretty quickly? And I've noticed even here when I did mine here in New York, that it wasn't an easy process, right? So it was like trying to figure out, okay, where do I go? There was like 50 million screens. And, you know, someone had to give my husband the number for someone to call just so that he can, because there was an exception that wasn't listed in the things online. So it's not just the digital literacy or the broadband access there. There's also something else going on where there needs to be some ease in doing these things. The other issue is with accessibility and assistive technology, right? So you need, if there was assistive technology or products in the workplace or at home, then they need to be able to have them at home. Some things are very specific to the individual or to the industry that they work in. But being able to have those products in the home would make it so that they can actually still do their job from home. And they need to waive the financial cost if they're going to use them at home. This has opened up new opportunities, right? The fact that we've moved and embraced technology has not been all a negative. It's actually been a positive for a lot of individuals, but there are questions about how long this trend will continue after COVID-19 is over, after we're all vaccinated and we figure out, okay, we can all go back to work. For some people, being able to work from home has actually been a benefit. So now telling them they have to go back into the office actually is in some ways going backwards for them, right? They won't be as productive as they were at home. For others, they have different access to things that they didn't even realize, right? And they're wondering if these things will continue when they go home, when they go back into the office, rather. And that's a question that we have to think about. I know we've been out of the office now for a year here in our department, but we're getting ready to increase going back. And I can tell you that it's going to be a challenge for some people who have already figured out how to do their jobs quite effectively from home. In terms of education, again, we've had access issues, right? And so there's requirements on adaptive and accessible approaches. Some students have lack of a computer or tablet. Here at SUNY Albany, that was one of the initial concerns. Some students were just saying, well, all I have is this this kind of computer and it doesn't work. And so I use the computers in your labs, you know, to kind of get things done. And then once we told them they had to go home, we had to figure out how they were going to continue their classes. And so our school actually started checking out a lot of the computers and tablets and laptops from the campus and allowing students to take it with them so that they can continue to have the same access to the technology wherever they went. And then there was a lack of internet with internet quality, right? So some people have internet, most people are using their phones, right? I've noticed my students using their phones, but it's not the same, right? Mobile access on your phone, looking at certain screens or websites is not the same as looking at it on your computer. And then depending on where you're going, right? Some students are going into coffee shops and things like that to get internet access. You're putting yourself at risk for privacy and security concerns, especially if you're not using a VPN, but you're also at the behest of when those places are open or closed. Initially, that was one of the first things. I was making arrangements with a lot of different students to, have one-on-one meeting times when they could have time off of their job, because a lot of them were essential workers, and two, where they can find internet that they could have access to. With this, there's something that didn't show up in the literature, which actually showed up in my personal life, is that I also noticed that a lot of students had concerns about education or using Zoom and things like that for classes as they were at home, because they didn't have the privacy that they had at the campus. So I had a lot of students that were moving, say, from Albany, New York, back to the city, New York City, Brooklyn, Bronx, Manhattan area, where they were living in smaller areas, smaller conditions, where it was like 4 or 5 family members in an apartment, and everyone else is doing something and they're trying to focus on their classes or listen to the professor, and they can't do that because everyone's talking in the background, or there was no space that they could actually be alone for an hour or two. And that also caused some problems. So I had a lot of students saying, well, I'm going to do this, but I'm going to drive the car to a location where I can just sit in the car and do it. So then they wouldn't be on their screen. And then being able to install proper apps on the phone or on their computers to continue classes is also another thing. So especially as professors, as we're using Zoom, probably Canvas and or Blackboard or whatever it is you're using for your what's it called, CMS, then you're able to, if you're using anything else, all of a sudden it becomes an extra burden, right, for the student. So let's say you're doing an ArcGIS class and you're like, oh, let's do survey 1, 2, 3. Then they have to figure out how to download that or how to put that on their phone or on their tablets to continue. Video conferencing. For K through 12, parents can't replace the special education teachers that you have, and that's what we basically ask them to do for a year. So for students with disabilities, we've noticed that there's been a lag in terms of what they're learning behind their peers. And then there's lack of assistive technologies that we're able to give to the students, especially K through 12, so they can take home and continue with their learning. Virtual school was extremely difficult for incarcerated youth. That was one of the areas that I found was a concern, and I figured I would point that out. And even though this wasn't like a large concern because it was only like one article that talked about it, I wanted to point out that there is a tick right here with incarcerated youth. Nearly 30 to 60% of the imprisoned youth have a disability, and they're having problems on virtual school. And then interpretation online, right? There's a time lag between real-time ASL interpretation, and that can contribute to learning difficulties unnecessarily. The ASL interpretation also can be a lag, especially as you're having bandwidth problems. So I know we've all experienced this where someone's talking and then they kind of stop and they're like frozen in time. Well, if you're trying to learn and you need some sort of interpretation, either ASL, and I would even say beyond ASL, is probably extends to any kind of language interpretation, that causes some problems. So with daily living, in this part, I separated into 2 sections, play and health. With daily living, the apps for behavior change has had limitations. So there's been a lot of different mobile apps in terms of telehealth, mental health, and they have become very limited in terms of thinking about people with disabilities or older adults using it. Again, digital literacy has varied in different patients. And so as we're making these apps or putting these things out very quickly, we need to start thinking about universal design, thinking about this for the entire of the community and not just one area, one section of it. Social media has become more popular than before. So similar information is not always available on all social media platforms. However, we have different populations, even different subsets of people with disabilities who prefer different social media platforms. So if you're putting things on Twitter, guess what? The people who like Facebook aren't actually getting all of that information, or the individuals who are in Instagram aren't getting that information. Vulnerable populations may have limited use of TikTok, especially people with disabilities. And this was very interesting because this was a study on TikTok that one of the researchers did, where they looked at a limitation because of the manufacturer or the person who created TikTok, where they limited the use of people with visible disabilities and individuals who they felt were obese. And they were caught doing that. And one of the things that they said was that they were doing it so that individuals would not be bullied online. But by doing so, they actually limited the expanse of use of TikTok. And so that has actually had a limitation for people with disabilities during the COVID-19. And then AI, we've moved from human-centered AI, and we moved towards, human-centered artificial intelligence. And we started realizing that it should not produce new inequities, but we also know that it has. And there's still a lot of research that needs to be done on what those inequities are specifically and for which populations. There's been a lot of work on social robots, especially during COVID, because people have been isolated in their houses, especially people with disabilities and older adults. Older adults tend to live alone. So these social robots have been coming out a lot. And I was actually in another presentation about a month ago where a lot of researchers were talking about all the work that they've done, great work that they've done on creating robots to help people with social isolation. But they're trying to design them specifically for people with disabilities. And the ones that are on the market, the ones that have been come to pass so far, have not been designed to better support the vulnerable populations that they intend to. Government services. I had to separate this, and I didn't really know how to put government services, so I put it under daily living. And that was because we kind of all interact with government services in some way. And so one of the things that came up with the court system, we started to use online, just like we're using now Zoom, to continue hearings and things like that. But we haven't really ensured equitable access to the court system's technology, especially that even though for some it's creating a lot more opportunities, but it may be creating more obstacles and barriers to justice for the individuals that are having to go through the court system and use this technology. And I will also say that this probably extends to using any kind of court government service, right? So I noticed that here I had to do change my name right over and get my new ID card. Well, they actually closed down all the DMVs. So you had to figure out how to do that online. And that wasn't even an option when they had it in there. It was an option that you had to change your name, you know, and all this other stuff. And then I realized, oh, because of what I was doing and because I was trying to get the, I forgot what they called it, not the real ID. There's a something else ID here, which has the flag on it instead of the star. And so when I was trying to get that, they said, oh, you have to come down, but you have to make an appointment and you have to do that online. So there's all these different things. Government services moved their front-facing offices from being face-to-face to being online. So now you had to know how to use these services. Same thing for organizations. And so I put organizational services on the government services because this extended to things like disability organizations, which could be government or nonprofit. Transportation services, things like public transportation that was geared directly towards people with disabilities or older adults, things like what we have here called Metaport transport. So like if they need to go to their medical emergencies or things like that, they can actually call a specific transportation service. But the same thing was happening with Uber and Lyft, right? You had a whole bunch of people who never used it before now having to use Uber and Lyft and not knowing how to use some of these services. And then IRS, right? So we had to do all of our taxes and stuff like that online. Individuals without internet access now had a problem trying to do that. That was probably one of the reasons why we didn't have to submit it until June of last year. But that became a barrier for a lot of people who were unable to do it. And so I see this year we're able to now have more offices that are open to help with tax services. Finally, I left health last because health gets a lot of discussion nowadays because we're talking about a public health emergency, right? So the telehealth is the way of the future for older adults. It's also the way of the future for a lot of Native American tribes. We've actually been talking about telehealth probably for the last 6 or 7 years, right? Where people were saying, hey, it would be great if we could have some kind of medicine that was easily accessible on different reservations or different locations. There is a need to expand the access to telehealth right now. I know here, depending on the insurance that you have, you may have an easier access to telehealth than others. Mine allows you to, it waives all the fees. So if you're doing telehealth with your doctor, you don't really have that copay as if you walked into the office face to face. And that's not true with every insurance, right? And I don't know what's happening for those who are uninsured. Community-based organizations need technology training to engage in vulnerable populations. And that is a huge thing, right? So these community-based organizations that are helping to kind of bridge the gap between, say, the clinics and the individuals, they're working to train vulnerable populations, but not necessarily knowing all the different issues that are going on with them. And so that's been coming up as a problem. And because one of the areas, this area is one area that I think people haven't been completely negating, the need for protections of vulnerable populations from scammers and measures to ensure personal data has come up. So we have this overlap with cybersecurity kind of issues coming into play here. And not only that, you know, you have HIPAA violations that have been going on. So that has also been kind of waived at this point. Mental health has become a huge deal, right? That everyone's talking about, but there's new uses in augmented and virtual reality to help with the pandemic and being socially isolated, not just for older adults or people with disabilities, but this may not be fully accessible to them. And then there's potential inequities in the access to these things, right? Augmented and virtual reality is not necessarily easy for everyone. I don't know how they do that for individuals who are blind or low vision, right? So we're trying to figure out what's going on there. And then contact tracing. These contact tracing apps have been used in a lot of different ways. Here in the US, we're trying to figure out how to make them information being provided in multiple languages, multiple formats. So it's accessible for people with disabilities and those with low English language literacy. And then these contact tracing apps, because of the way we are in the United States, requires individual app installation by the user, and not everyone knows that. They have an app here in New York, but I didn't really know that it existed, and so I haven't downloaded it on my phone. The other thing is my phone is pretty full with apps right now, and so I don't even know what I would delete to be able to add this, and so that's another issue, right? And then there are concerns in the public about these apps being used for broader surveillance beyond the pandemic, right? Are they going to continue to track me in some way? So that has come up in a lot of the research. So when we revisit the lens of vulnerability, we start to see some things, right? With pre-existing inequalities, we already knew there was access issues to broadband wireless, assistive and accessible technology issues, digital literacy, reliability of the information found online, engagement with the community has been lacking, and the financial cost of some of this equipment has been extremely high for the individuals I'm speaking about. But the exacerbated inequalities is this access to the technology from home, right? Access to tech support from home. When we're talking about students, these parents now having to replace special education teachers, real-time lag for interpretation, broader surveillance beyond COVID-19, privacy and security concerns that expand beyond what we thought we had before COVID, but we have to give so much information online. Are we thinking about this? For example, I did tell you I have a child. One of the things that's come up is a lot of the doctor's offices are asking for a lot of information via email, but I've noticed a lot of them don't know how to encrypt their email, but now they want personal information, they want social security numbers and things like that, but do they know how to protect that information online? What about the expansion of access post-COVID-19? Not necessarily a negative, but more of a positive. People who have now been able to fully engage in society because we've moved online, are they going to still be able to fully engage once we have figured out this COVID-19 thing from an infectious disease standpoint. So that's one thing that I started, and that has led to several different current and pending projects that I have going on. So I got a SUNY seed funding for a study on older adults and COVID-19 messaging. And from that, I started looking at the submission to NIH. So I've already submitted some older adults and risk communication messaging. COVID, the NIH Converge Working Group, I don't know if you've heard of this. This is the Natural Hazards Center. They had a Converge Working Group. I was the lead for one on technology and COVID-19 and created a research agenda there. That has led to iConference workshop that I just did. That iConference was in China and they did that. And so this was on supporting and engaging diverse and vulnerable populations with technology adoption amid COVID-19. And because that was a conference that was international, we expanded our research into international concerns and how it differed. And so I was talking with Dr. Wu earlier and realized, hey, things are different here, right? The contact tracing is not the same. He was telling me about contact tracing in Taiwan, and I was telling what I learned about contact tracing in China. And like, you have a little wristband that turns different colors if you test positive versus if you are connected to someone else who tested positive, or if you were not connected to anybody, right? So you have this red, green, and yellow kind of thing going on. And we have a journal of assistive technology where we're talking about the coronavirus pandemic and the accessibility technology for education, employment, and lifestyles. The last thing here is differential impacts on COVID-19 in New York State. I was part of an engaged working group working with minority health disparities. And the thing that came out of that is we're now talking about addressing differential impacts of COVID-19 in New York State, which is an edited volume. And because we are getting too close to time, is that right, Tristan? I'm going to share with you something else, which is basically some links for your students and everyone. So if you wanted to know a little bit more about what was going on with me, there is a website here. I'm going to put it in the chat and quickly go on. This website will tell you about all the people in our college and the things that they're doing. We did community engagement, student leadership, faculty leadership, research excellence. You can learn more about my older adults in COVID-19 study by clicking there. The other thing is these COVID-19 response working groups. One was longitudinal risk communication, which was done by Jeanette Sutton, and I was on her team there. And then the technological innovations is the one that I led with another student. And we had a group there, and you can kind of click on those. The other thing is that I just mentioned was the differential impacts of COVID-19 in New York State. There is information about that online. This is the first issue brief that we had. This was basically done at the behest of the governor's office to kind of look at what was going on in New York State. And so he tapped UAlbany and our President Javidan Rodriguez, and he put together a team of researchers. And so I was on that team alongside other disaster researchers, Alex Greer and Samantha Penta. And this is kind of the brief that came out of that. And last but not least is, for me, we started talking about addressing the differential impacts of COVID-19 for racial and ethnic minorities. And that has led to a call for extended abstracts, right? So if you guys are interested in talking about, if you've looked at anything related to COVID-19 in New York State or that can relate to New York State, you may want to submit something to this. It is going to be kind of a two-part thing where we will have a symposium in June, and then it will turn into an edited volume. And so you can learn more about our timeline here, about the editors, of which I am one, and some of the topics of interest. And I will say that we did put topic of interest, innovative use of technology. So if you have any information around that, I am totally interested in that. So I will stop sharing and let you guys ask any questions. Thank you so much.
Well, wonderful. Thank you so much, Dr. Burnett. And yes, if anybody have questions, this is your chance. Uh,
Oh,
Nikki?
I see one. Yes.
Hi, I'm curious how you're defining recovery when you look at COVID-19 as a disaster on your chart. You
Mhm.
had sort of damage, impact, recovery. So how is recovery defined?
Yeah, so I haven't defined recovery because I feel like we're in recovery and then we're out of it, because what's happening in COVID-19, which is different than others, is that it's not just a protracted disaster, but that it has these ebbs and flows, right? So we've had an increase in COVID-19 cases, and then we have a lull, and then we have an increase again. And so right now we're going through another increase. And I think what's happening is more overlaying of a response recovery, kind of the phases of disasters. But I'm also of that, I guess I want to say the Dave Neal, it's not just one after the other kind of thing, right? So we have them, they overlap, and we see them overlapping constantly here because it's not just one and then the other. We have a COVID-19 with a bunch of different waves in the United States, at least. That's what's happening here. So I haven't defined it because I kind of don't need to. We haven't gotten to the recovery part for me where we know what's happening. Until we finish COVID and see what's going on, then I'll start to be able to go backwards and say, oh, this is kind of how we can define recovery, so to speak.
Thank you. And here we have another question in the chat
Oh,
room. During this pandemic and after, do you think it is beneficial to us to still have class remotely?
yeah.
Also among the projects that you have done or that are pending, which one is your favorite?
Okay, so the first thing is the first one, I feel two ways about that, right? So as a professor, I can tell you that I probably reach the students better face to face, right? We have more opportunities to do different kinds of, what do you call it, activities and discussions that are more robust. However, I will say for some students, being online has actually been beneficial. Being online, for the students who are quiet, they can ask questions in the chat where they weren't asking any questions at all. For students who may have like 5,000 things going on in their lives, they're able to now attend classes for maybe a short amount of time where they would have not come to class at all because of all the things going on in their life. So I feel two ways. It depends on who you're talking about. I know that this is beneficial for some population. That it's not even a question about that, but what you're gaining, and if I'm looking at it from just the robustness of the class and getting everything you need for the money that you're paying, I would say the face-to-face is giving you more, right? That you're going to get more out of the class. You're going to be able to engage more, and I find students learn better. The other thing I will tell you is that the minute we went online, not just our university, but I noticed other universities started having issues immediately with cheating, right? So we went online and then everybody started cheating. Don't know if there's, I didn't do any research on it, but there's this correlation, which may not be causation, right? So then among the project, oh, which one is my favorite? I proposed this NIH proposal, which was it's really interesting. I have a really great team from Georgia Tech and Emory with me. And what we wanted to do was kind of doing a quasi-experimental study. So we wanted to do one that was purposeful, right? Not just happenstance, but purposefully looking at what's going on. And we wanted to use virtual reality on older adults to basically see how they respond during certain types of messaging that comes across. So that one, if funded, would be probably the most fun, but it was really fun putting it together and thinking about all the things and how we would do it. And that's probably the one I want to do the most. So I see one from Joshua. I'm reading it here, so sorry if I got quiet. Yeah. Okay, so that's a great question. So how can emergency management professionals stay aware of the technology needs of vulnerable communities, especially as some things we are currently doing just remote, just to go back to normal? I think that's a good question. You kind of hit on two things in there. The first thing I would say is one of the things has been the same thing that everybody who's looked at vulnerable populations says, is that you need to include the community first as you're doing things. So as you're in your blue sky conditions, or as you're doing your planning phases, you need to be reaching out to those vulnerable communities so you'd actually know what their technology needs were, or how they were using technology differently or innovatively. And then also that would give you an insight into some of the ways in which they're using technology that if you go back to normal, they're not going to have anymore. And this is not really a new concept, right? So when I first started looking at technology in the context of disasters, one of the first studies that I did was in Floyd County in Atlanta, in Georgia rather, and they had a tornado that went through there. At the time, they had just started using social media, and they were like, "Oh, this is great. We're using social media." The tornado hits. They're like, "All hands on deck. Everybody, we need you to do stuff." And they didn't put anything on social media, and they ended up having a huge kind of conflict with the deaf community in that county. And that was during their, they had a town hall afterwards to kind of see how everything went. And the deaf community went there in droves and to say, hey, we were all of a sudden had access to this information because you were on social media. And then when we needed it the most, you didn't put anything on there. And so then all of a sudden you started realizing that you gave them access and then you took it away. And so that's kind of what I think is happening here with the COVID-19, right? So we're forcing everybody online, everybody's creating things, not just individually, but corporations and organizations are figuring out how to do things online. And then when we go back, what's going to happen, right? We've allowed certain individuals to get this information, but now what do we do afterwards? In the same vein, right? Even when I think about things like food delivery, right? All of a sudden you had access to greatest foods that were not being delivered before. and then they'll take it away afterwards to get everybody come in.
I see.
Oh, that's it.
You have a question too?
Yeah, I have a question if I can throw one into the mix.
Yeah.
Hi there, I'm Dr. Ronnie Schumann, so I'm one of the assistant professors in the department. I love your talk because it hits on so much of what we discuss in our social vulnerability class. And one thing that we try and emphasize, or I try and emphasize, is that technocratic solutions aren't always the answer, right? They can grant access, but they also are problematic because they present these access challenges that you've talked about. So do you have any thoughts on best practices for merging this increasing use of technology with the human element, right? Because that really doesn't, supplant the need for humans to assist and be there in the process.
Great question. So it's interesting because when I joined with the College of Emergency Preparedness, Homeland Security, and Cybersecurity at Albany, one of the things that got me was that the information science group is actually part of our college. And so I started one of the things, the study that I told you that I was really excited about, I'm doing with some of the informatics and information science professors, and they look at the human-computer interaction. And so that's kind of what you're getting at, is what's happening with the technology and what's happening with the human individuals. I don't study that, but I do have now some people that I'm bringing in slowly to the disaster world to say, hey, we need help with this. And so I would kind of connect you to some of my colleagues to get, because it is a great answer, but that's how I pull them into some of the projects when I'm thinking about technology and how it's being used, because it's not just the individuals using it outside, but I also think we need to think about this in terms of our emergency management professionals who are using technology, and to make sure that they're thinking about the way they're using it as well. So I think it's a great question. I can't actually answer for you, but yeah.
I hadn't thought about it in that realm. I was thinking more about having humans along, like with the telemedicine, telehealth, to kind of shepherd individuals through the process of using technology. Right?
Okay, yeah.
That you might need an intermediary.
Yes. And I think that actually came up in my talk, is that I said that's something else, and I haven't really figured out the term for that person, but it's someone to help give you an example. When I was talking about Florida, if you look in the news, there are a number of high school students that made a little nonprofit business to help out older adults with getting online to make their appointments for their vaccination. And it became like this new nonprofit business. And there was a number of high schoolers, right, that were doing, because they realized they were helping their grandparents. They were helping these people. They're like, who's helping the other people get online? And they didn't realize how to do it. So yeah, what you're talking about is basically that person to help. It's that tech support that's at home. And that came up in my talk. People were saying it's not just the vaccination, but of course, as we're using all these different technologies, there's some tech support that needs to happen at home, that needs to happen with the vulnerable populations in a way that's most accessible to them. And so for older adults, maybe it's getting help with that from your family or your friends. And if you don't have family or friends, is trying to figure out what community service can help you with that. The other could be something along the lines of different language barriers that may help happen. So if you're speaking a different language, or if you need ASL interpretation or something like that, yeah.
Okay, well, thanks. And we have one last question from Angelina, and she sent that direct to me. So
Okay.
I'm gonna ask you that question. So what do you see the issue with children getting vaccination?
Oh.
COVID? You have a
I don't do that work. So what's interesting is that I'm not a medical doctor, so I don't know what the background is in terms of the kids and vaccination. I do realize that I think here in New York, they said 16 and older are able to get vaccinated. And if I'm not mistaken, the Pfizer vaccine did have a larger study which had more kids in it. So you may want to look at their results and see what happens. I think that's what everyone was saying, is like the Pfizer one had a more robust study panel. It had more minorities in it, and it also had a larger subsection of children. But the children, I think, started at 16 or 15 or something for their study. So below 15 or 16, when I talk to the pediatrician, they have no idea. So they don't know what's going on. That's just, there's no research around that, but there is some promising news about mothers who are still breastfeeding or nursing their children, that there is some evidence of being able to move the vaccine through milk, but it's not, it hasn't been studied very well. Yeah. So they don't know all the things about that. That's all that's just basically what I've read and what I know, because I've been asking the same question.
Yeah. Well, thanks. Thank you. Okay.
David, you have a question? David has a question.
Yeah, David has a question too.
Wow. A good platform or reliable app to assist ASL audiences. Right now, Zoom is not bad. The last conference I was at was actually a conference specifically about disabilities, or individuals with disabilities rather. And we used Zoom. They'd use closed captioning, a live closed caption, and they also had interpreters. So now what you do is you actually still get interpreters, like the individuals, and you invite them to your Zoom conference. And then the individuals who need ASL can pin both what's happening, like here, like if I'm talking, and the ASL interpreter, so they would see both of them on their screen at the same time. And that works out pretty well, especially if you have good bandwidth. So like if I freeze, then it kind of stops the ASL interpreter. If the ASL interpreter freezes, then you have this backlog of information that you can't get through. But what we did find that last conference was the live captioning was not the best. And it was probably not the best because when you're talking about a lot of different technologies, or you have a lot of jargon, that didn't work out very well for whoever was typing it up. They got a lot of things mixed up. So it would help to kind of preference someone who knows a little bit about the area before they start typing it really fast, because then they mess up. So that was one of the areas where a lot of the individuals who are deaf or hard of hearing they did make it known in chat that they could not follow the closed captioning, not the one that's inside of Zoom, but the live closed captioning that we had. So it's not necessarily the platform of the app. I think it's about making sure that you have a person, like you've actually called ASL interpreters and had them there. And it does make a difference for people who are trying to follow along.
Okay, well, thanks. Well, thank you, everyone. This has been wonderful. And I think it's about time. So we are gonna finish this right there.
Thank you. Thank you so much. Tristan, I will say one thing just to answer David Wood's question. I put in a link, not a link, I put in a name, DeafLink. You guys are in Texas, and DeafLink is in Texas. And they actually do a lot with emergency managers and emergency management to make our morning messages interpreted through ASL. So you might want to connect with them. They have a whole slew of interpreters that already know our jargon.
Thanks.
Okay. All right. Thank you so much for having me.
Yeah, thank you for coming and present your study. Bye.
Okay. Thank you. Bye.